We're joined this morning by Dr. Michelle Dunbar, who's a podiatrist, right?
Yes.
In at ACMC.
Yes.
And Michelle, I think, was our first guest on the show.
In January.
In January.
Yes.
It's almost been a year.
Exactly.
Were you kind of nervous that first time?
I was, and my hands are sweating a little bit right now, but it's fine.
Yeah, we wanted to have Michelle back and talk about problems with the feet. And I'm going to turn it over to you right now, Michelle, and let you start out the show, and then I'll jump in. Chuck and I'll jump in with some questions, okay?
Okay. I did a physician's forum for ACMC a couple weeks ago, and that was sort of geared towards things that are common in the winter. So probably the most common thing that you can think of is frostbite. Mm-hmm. And the most common area to have a frostbite are your feet and your hands. And so what we kind of touched on is why that's the case. It's actually a survival mechanism that your body kicks in, that it wants to shuttle all the warm blood and nutrients to the vital parts of your body, and so therefore your fingers and your toes, hands and feet are deprived of that.
Right.
Okay. So what happens is little ice crystals form in between the cells, and when it does that, it's drawing the water out of the cells, so it's dehydrating them. And actually the true damage from frostbite occurs once the rewarming starts, because once the blood starts flowing again, that's whenever the vessels become damaged, leaking into the skin, swelling, things like that. Unfortunately, you don't really know how severe the condition is until days and weeks after. The first thing you notice, obviously, is that your hands or feet will feel numb. Mm-hmm. Some tingling and burning sensation. In the frostbite kind of has the same, it's categorized very similar to a burn. So a first degree would be, you would feel the prickling and the pain. Your fingers or the toes, the skin would become white, but there isn't any true damage. You recover without any problems, although you might have a little bit of sensitivity to the area. In a second degree, you actually form blisters, but they're usually just water blisters, things like that. You might have some scarring, but even as well as the pain and in the end sensitivity, but no true damage. It's when we get into the third and fourth degree frostbites where you have true damage, but unfortunately it's not recognized until days later. Mm-hmm. Frostbites obviously have ended in amputations and things like that. In the third and fourth degree, you get blood blisters, then the area becomes black because the tissue is dead, and then over weeks and months the tissues start to differentiate, and then even if surgery was required to remove dead tissue, even that's delayed for weeks and months to let the body...
What would be the sign, like you say, it doesn't happen right away? What would be the signs then? Discoloration, but first thing, or
it's really hard to say. It's kind of use a little bit of common sense. If you are in fear that you've been out there way too long, I mean, you kind of get an idea or gauge just from common sense whether you need to seek medical attention. And if you're in certain risk categories, diabetics, elderly, problems with circulation, you should probably be evaluated at the emergency room regardless.
What about this? Now, what if you have socks and boots on? Can you still get frostbite through that?
Oh, definitely.
Really?
Definitely.
I always thought it was just exposed skin.
No.
Okay.
It's more of the time period that you were out there, as well as what the temperatures were, and then of course how well you were protected. But yes, you can get the frostbite through skin that's been protected.
Even gloves.
How cold does it have to be before frostbite can settle in?
Really, I researched that, and it really does not give a temperature. Obviously, the freezing temperature, so 0 degrees Celsius, it would occur, but it has to do how long you're exposed and how well you're protected. But there's some basic things that you can start at home. So the basic things are rewarming. So that includes taking off wet socks and boots and whatnot, and clothing that were wet, and then warming yourself with blankets. You shouldn't soak your feet in warm water to attempt to do that. If you think the condition's that bad, you should be in the emergency room for a warming. You want to remove, in the case of your hands, jewelry, because swelling sets in pretty quick, so you wouldn't want that to restrict circulation. They suggest that if you are in fear that it was a significant frostbite, not to do the typical, rubbing, warming, things like that, because it causes more tissue damage.
Okay. Have you had any cases of it since you've been here?
Yes.
Really?
Yes. Luckily, she recovered completely. I mean, she has some sensitivity. She has an area where she had some tissue loss, and now we're doing some things to take some weight and pressure off that area for comfort.
Was that in the toes or the feet?
It was the foot, yeah, the bottom of the foot.
Okay, the bottom of the foot.
Well, it included her toes, but it's the bottom of her foot that she's having the problems with now.
So So somebody comes to you with that situation. What's the first thing you have to do?
I used Silvadene cream on her. Silvadene, works great with, lots of wounds, particularly frostbite and burns.
Okay.
We kind of just kept that on her, loose sock, splinted in between toes where there was blistering, and we let weeks and weeks go by before I cut away any of the tissue.
Really?
Yeah.
So surgery was required?
Well, no, it was just office.
Okay.
Cutting away in the office. So
Is there a particular age group that this could happen to more than others?
the elderly are definitely at a higher risk for various reasons. Circulation, the skin seems to be a lot thinner. Many of our elderly are probably not well nutritioned and whatnot for various reasons.
How about time-wise? Can it happen in 10 minutes?
Yes.
That
definitely.
quickly? Wow.
I didn't realize it would happen that quickly, I guess.
didn't
The one thing that I've always been concerned about, and I don't wear gloves a lot, but I've never had that problem because I don't stay out a long time in the cold, but I was always wondering about your face, have you seen frostbite on the face?
I've seen it, but I haven't treated it.
Right.
Yeah,
Really.
particularly on the nose and the cheeks.
Yeah.
So those are the most common exposed
Ears
areas.
too, maybe?
Ears? I would imagine ears. Yeah. Amazing. So basically what you're saying, to thwart this from happening, stay out of the cold as much as you can.
As much as you can.
Yeah.
Or, if you have to be in the cold, which we live in Northeast Ohio, we really don't have a choice. Just protect yourself. People that have a tendency to have cold feet or have problems with circulation, and then we always concern about diabetics. You might have to double up on socks. You want to be mindful of the type of shoes that you're wearing outside. I mean, you want to wear a boot, and obviously a waterproof boot. And when you get back in the home, removing these things if they've been wet.
What about recovery time from frostbite? How long does that take before it gets back to normal?
Yeah, if we're talking about the more significant, the 3rd and 4th degree, it takes months.
Wow.
Months to, probably
Oh,
a year.
cow.
Whenever I was in my residency, I did a few months at the VA, and unfortunately, some of our veterans aren't taken care of like they should, and many are homeless and whatnot. So we see a lot of problems with frostbite in that situation.
I'm glad you brought that up because that's something we've been stressing with this weather condition, telling people to keep themselves insulated and wear layered things, and probably, like you say, an extra pair of socks over the regular ones would probably help too.
Right.
Another thing that threw me off was when you said the bottom of the feet. It never dawned on me that would be a case. You say there's some exercises
Yes.
that you want to go over.
Probably one of the biggest fears in the winter, besides sliding around in our cars, is falling.
Right.
So there's some simple exercises that you can do to start strengthening your ankles. 'Cause
Okay,
that's usually
before you
what
do that,
comes-
you are getting a phone call.
Oh, okay.
Okay. Good morning, you're on the air.
Hi.
Hi.
Why would a person who is a diabetic have a toe that they
towards the second toe?
Yeah, and towards the other toes.
Yeah. Often we just see that as a bunion, and if it's a bunion, the side of the foot will. Wait, here, I actually have a model. If it's a bunion, this bone right here, which is called your metatarsal, starts to move over. And whenever it moves over, it makes the big toe go in the opposite direction towards the second toe. So that's what we call bunion. But sometimes people just have the second toe move over. And, basically it's just from tendon pull for various reasons, most likely the way that you walk.
It's actually longer.
It's longer?
The toe's longer.
Big toe.
Oh,
Longer.
and it wasn't longer prior to that?
No.
Oh, okay. Very unusual. I definitely see your family physician. There's a few conditions out there. I want to call it giantism. I can't remember the proper term, where later in life, and it probably would occur more towards 40 or 50, where the bones would start growing. And that's a systemic problem. That's why you'd have to see your family doctor for it. Very common in the hands and the feet to notice it there.
Okay.
But it has, once again, I don't want to make it seem like this is light. I suggested if that was a concern that you should see your doctor, because those conditions have problems with your heart as well and can cause enlargements of your heart. So if that's the case, that person should be evaluated.
Thank you.
Thank you.